Hi, my name's Emer McEntee, and I'm going to be presenting on inclusion health in critical care. So it's a retrospective, descriptive cohort study of ICU admissions among people experiencing homelessness. And this was done alongside Professor Cheallaigh in St.James's Hospital, Dublin. So just a bit about the background, aims, and methods. So in St. James Hospital, inclusion health is the provision of medical care to patients in the hospital who are experiencing homelessness. And homelessness is associated with multiple interacting medical, social, and structural disadvantages that all contribute to poor overall health outcomes. And then just a bit about our methods. So data was collected from all the patients admitted under the IH team who required admission to ICU during that same admission. And the data was collected over a 1 year period, and it was collected retrospectively from their patient electronic health records. And those are some of the variables that we collected as well. So the main aim of this study was just to characterize the patterns of ICU admission and clinical outcomes in IH patients, and as well as that, compare this data to the general ICU population in St. James's Hospital. So a bit about our results. So here we have the ICU Irish National Audit data. So looking at general ICU population. So as you can see, the mean age of the average ICU patient is 60. The gender split is 65% male to 35% female. Of their emission sources, so non-surgical emissions account for 65%, with surgical emissions accounting for 35. And regarding their mortality, so overall general ICU population has mortality of 13% and an overall mortality of 19% during that admission. When compared to IH patients, so in total, there is 28 IH patients admitted to ICU over the course of a year. The mean age was 49, with a split of 82% being male, 18% female, and 96% of those were medical admissions. And the mortality was similar, with mortality in ICU being 14% and the overall mortality in that admission being 18. It's just points of discussion. So overall, there is much younger population seen in IH when compared to general admissions to ICU. However, when it comes to this population, chronological age, I often underestimates their vulnerability. So studies have shown that people experiencing homelessness demonstrate advanced biological aging. So despite their younger age, they may resemble features of a geriatric population, which impact their critical care outcomes. And regarding their admission type, so majority of them were medical admissions, with almost 50% of those getting admitted through the ED, which may reflect their delayed engagement with healthcare services, which result in a presentation of much more advanced disease. So it's been shown that socially excluded populations have shown to have lower utilization of primary and preventative healthcare, and they rely a huge amount on emergency services. So that later presentation may contribute to greater illness severity and an increased need for ICU care.